Hello, I'm Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, actually I'm going to put out a couple studies here in the description, but this one really hits home, and it has everything to do with the intervertebral discs, or the vertebral discs that we have in our back, and we have them present in the cervical, in the thoracic, in the lumbar region. Like they're a very important part of our spine and how we feel and how we move and whether we have pain. There has been some concern over the years that maybe there's an infection that plays a role in disc degeneration. And this data has been kind of tossed up in the air. We're not quite sure. These studies that we have now put a little bit more information about whether or not infection plays a role, and I'm going to give some thoughts and advice about what to do about it. But the first one is looking at 63 patients who had the disc removed at surgery, and they had degenerative disc disease. They were compared to 5 people who did not have, they had a possibly injury. They had the disc removed and looked at. And specifically, they looked for the presence of a bacteria called Cutibacterium acnes. It's a skin-type bacteria that can get into the system and may or may not be growing in the spine or in the discs. So what they found that 32% of the people with degeneration had this bacteria growing inside of it, and 0% of the controls. Now there's only 5 versus 63. The average patient in the degeneration category is 54, which is like, that's my age. I hate to kind of think of those people already falling apart, but there's a lot of things that we do that have a tendency to break down the discs. I'm going to talk about that in a second. There was another study that looked at taken out during autopsy, and because the question is, are these bacteria just growing there? Are they actually causing inflammation and problem and pain and dysfunction, degeneration? And this laboratory study started pushing more in the direction of they're actively growing there and creating problems and inflammation. So the data is becoming clearer over time that bacteria do play a role in disc degeneration. So what does that mean? It doesn't really change much. 3 things that I think are very important for maintaining healthy discs. One of the things that's interesting, I'll talk about hyperbaric in a second, but the first one is cardiovascular disease. I consider our discs like a sponge sitting in the middle of a puddle. Now, if we just sit there and stare at the puddle, there's not a lot that happens. But once we start stepping and unstepping on the sponge, you start getting this fluid exchange. Waste products out, new nutrients in. Exercise is like stepping on that. It's priming, it's pumping the discs, it's getting things moving. That's why movement is so freaking critically important for spinal health. The second thing, that puddle, the pond that the disc is fed by small blood vessels. So cardiovascular disease, or anything that damages the blood vessels, is also going to have an impact on disc health. We want to have that puddle loaded with good nutrients. So that means cigarette smoking, that means poor cardiovascular health, that means not exercising. And those things also play a role in immune function. So making sure that you have a healthy immune function and having a healthy lifestyle choices. Those are all really important things, and it shouldn't come as a big surprise that they are good for spinal health. That's both the neck, the thoracic, and the lumbar spine. The last little tidbit is, since we have bacteria growing there, and one of the things that has been shown to be helpful for bacteria growth that we have a hard time controlling is hyperbaric. Having a hyperbaric chamber in the office, this one particularly hits home, especially in a chiropractic office. Could we use hyperbaric to increase oxygen penetration to the discs and allowing the immune cells to better fight off this Cutibacterium, which is an anaerobe? It doesn't like oxygen. So if we could flood the disc with more oxygen, could that potentially help? Well, we have quite a few studies that suggest that hyperbaric treatment actually does help with disc problems. So Just going to throw that out there. It's another thing to consider in your fight against disc degeneration, on top of exercise, on top of a good quality diet, and on top of boosting, keeping your immune system healthy. As always, I'll post a link to these particular studies in the descriptions. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.